I would like to now introduce Dr. Reshma Shah. So Reshma Shah, MD, MPH, was raised as a Jain in Pittsburgh, and she's currently in the Bay Area. She's a board certified pediatrician and adjunct instructor at Stanford University School of Medicine. Dr. Reshma Shah co-authored Nourish, the definitive plant-based nutrition guide for families with Brenda Davis. She received her undergrad and grad degrees from Johns Hopkins and her medical degree from Drexel University School of Medicine. And she lives in the Bay Area with her husband and 2 children. So without further ado, I'm going to turn it over to Reshma.
As a pediatrician, I'm going to be talking a little bit today about veganism to heal yourself and to heal the planet. And I have 3 main objectives today. I'm going to review some of the health advantages and safety issues around vegan diets. I'll talk very briefly about the environmental impact because we have so much more on that to come. And then finally, I'm going to close with a little bit of a discussion about issues around dairy. It seems like about half the people here are either already vegan, but mostly vegetarian. And so I think for us in this community, it's probably much more important to talk about dairy issues specifically. So I want to begin by first acknowledging that there is a lot of confusion when it comes to nutrition. You know, one minute the headlines are telling us that cholesterol is bad for us, and then next minute we're seeing headlines that say it's okay, eat butter, it's totally fine. And I think that a lot of these headlines can be confusing, and they contribute to our feeling that we really don't know what diet is best for health. But when you look at the consensus from the leading dietetic, medical, public health organizations around the world, there's actually not that much disagreement, whether it's the World Health Organization, the American Cancer Society, the Harvard School of Public Health. And what all of these leading medical and dietetic organizations tell us is that we should be looking to limit our consumption of the foods that promote disease, such as saturated fat and trans fat, refined carbohydrates, cholesterol, and especially red and processed meats. And if these are the foods that we should be limiting, these are the foods that we should be including. And it's not a surprise. It's fruits, vegetables, whole grains, beans, nuts, and seeds. And so there are a variety of different dietary approaches, and we're really going to be focusing on the last 2, vegan and plant-based diets. And I wanted to begin just by defining what we mean by a plant-based diet. So a plant-based diet is essentially, or more specifically, a whole food plant-based diet is a diet that aims to maximize the consumption, of nutrient-dense plant foods while minimizing heavily processed foods and animal foods in the diet. And it encourages lots of vegetables, fruits, whole grains, lentils, beans, seeds, and nuts. And I think it's important to just make a little bit of a distinction between vegan and whole food plant-based. So a vegan diet is essentially a diet that eliminates all animal foods in the diet. And this can go a long way towards curtailing animal suffering and protecting our planet. But I think all of us would agree that the foods at the top of this slide, though they may be vegan, are not necessarily health promoting. And so a whole food plant-based diet is focusing more on these whole foods that protect the planet, help to mitigate animal suffering, and also promote health. And I think it's important to remember that what we do 80 to 90% of the time in terms of those heavily processed foods is much more important. So just wherever you are, you can begin by focusing on progress. And so broadly speaking, there are 3 vast advantages to a plant-based diet. It's a healthy, sustainable, and compassionate way to eat. So why even focus on nutrition? I'm going to spend a little bit of time focusing on the health aspects of a vegan or plant-based diet. We know that nutrition is intimately connected to many of the chronic diseases that we see in the United States and throughout the world. It's estimated that 80% of heart attacks, 90% of type 2 diabetes cases, 70% of colorectal cancer, and a variety of other medical conditions are directly related to what we eat. For those of you who are not familiar, there are these populations throughout the world that are called the blue zones. So when we're looking to answer the question of what diet is best for health, we can learn a lot from the blue zones. And the blue zones are these geographical pockets located throughout the world where they have the highest concentration of centenarians, so people living to age 100 and beyond. And researchers wanted to know what was the secret sauce, what allowed these communities to enjoy such vibrant health. And what they found was that there was actually quite a few common characteristics of these communities. There was a lot of overlap. They had a strong focus on family. They had low rates of smoking. They led physically active lives. And when you looked at diet specifically, they all followed a plant-based diet, and all of them ate legumes or beans as a staple in the diet. There's been a lot of research looking at the association between plant-based diets and overall health outcomes. This article that was published in the New England Journal of the Journal of the American Medical Association in 2016 showed that high animal protein intake, which includes dairy and eggs, was associated with an increase in overall mortality. And this was especially prominent for people who had one lifestyle factor, so hypertension or diabetes. In fact, many of the leading causes of death in the United States are preventable. The number one cause of death in the United States is heart disease. 1 in every 4 Americans will die from heart disease. And researchers estimate that 90% of our risk factors related to heart disease are modifiable, which means that we have some say in our risk of developing heart disease. And the 4 most common factors include smoking, exercise, obesity, and of course, diet. Studies have shown that even in people who have known heart disease, so these are people that are on blood pressure medications or have had a stent, you can further reduce the risk of developing future heart disease by 78% simply by making aggressive diet and lifestyle changes and, decreasing our consumption of saturated and trans fats, those heavily processed foods that we talked about. I think it's important, especially in this community, to recognize that saturated fat intake is a risk factor for heart disease. And when you look at where our saturated fat consumption comes in the United States, only about 25% comes from, animal flesh foods like chicken and beef and pork. The remainder of it is actually coming from dairy and other, snacks and desserts. And specifically in the vegetarian community, half of the saturated fat overall in the United States comes from milk sources. So things like cheese. I think the number one source of saturated fat in the United States is actually like cheese pizza, specifically as a food. So for people who are vegetarian, the vast majority, excuse me, the vast majority of saturated fat is actually coming from dairy foods. And again, plant-based diets, there's been multiple studies showing that following an entirely plant-based diet can reduce your risk of developing heart disease. Excuse me. And as a pediatrician, I'm particularly interested in the risk of heart disease even in children. We know from autopsy studies that even though you may not have a heart attack until you're 60, 70 years old, the changes actually begin in childhood. From autopsy studies, we see that we can see fatty streaks in the aorta of children as young as 3 years. By age 10, nearly all children have evidence of these fatty streaks. And by the time we're in our 20s, we're seeing these fatty streaks even in the coronary arteries. So heart disease is absolutely, it's affecting our children as well. The second leading cause of death in the United States is cancer. It's estimated that 1,500 people die each and every day from cancer. The World Cancer Research Fund published its cancer prevention recommendations a few years ago. And some of the things are obvious: limiting alcohol consumption, not smoking, maintaining a healthy weight. But again, diet is also a part of this formula. The report and the committee concluded that a healthy diet and lifestyle behaviors could prevent 40% of cancer cases, and that basing our diets around plant foods like vegetables, fruits, whole grains, all of which contain fiber and protective phytonutrients, can reduce our risk of developing cancer. The seventh leading cause of death in the United States is diabetes, type 2 diabetes. And you can see there's been a sharp increase in the rate of type 2 diabetes since the mid 1990s. Some experts estimate that if the current trends continue, that by the year 2050, 1 in every 3 Americans will have type 2 diabetes. And again, a plant-based diet, and more specifically a vegan diet, has been shown to reduce our risk of developing type 2 diabetes. In this study, there was a 60% reduction in your risk of developing type 2 diabetes for those people that followed a vegan diet. So just to sort of summarize the health advantages, there was a paper that was published a few years ago comparing a variety of diets. And the conclusion of this paper was that the evidence is strong, consistent, and compelling that a diet of predominantly or even exclusively whole plant foods can promote health, selectively treat and reverse disease, and confer comparable benefit to the planet. What we should be eating then for disease reversal and health promotion for the sake of people and planet alike is clear. The truth is that we should all be eating plant predominant diets. The what of future eating is not in question. The questions are all about how we get there from here. And so I'm just going to briefly cover a few of the environmental advantages. We know that animal agriculture is a leading contributor to climate change. Some experts estimate that 51% of greenhouse gases come from animal agriculture. It's the leading cause of rainforest destruction, species extinction, ocean dead zones, and water pollution. It's responsible for over 90% of the destruction of the Amazon and occupies 45% of the Earth's ice-free landmass. In terms of water usage, the meat and dairy industry use up to 1/3 of the Earth's freshwater supply. Looking at this from a slightly different perspective, it takes 2 football fields worth of land to feed one person the standard American diet. And as vegetarians, we have a lower environmental footprint. But if you follow an entirely plant-based diet, you could feed 14 people using those same 2 football fields worth of land. Additionally, it's estimated that 50% of the world's grains go towards feeding livestock. And this is happening that at the same time that close to 1 billion people are going hungry each and every day. Some experts estimate that if we diverted this grain from animals more towards feeding people, that we could largely solve the problem of world hunger. Additionally, 80% of the antibiotics in the United States go towards animal agriculture. And this is not only bad for the animals that get the antibiotics, but it's bad for the people that consume the animal products from these animals. So we know that food is intimately connected to health, and increasingly we're seeing that food is intimately connected to the health of our planet. There was a report published a couple of years ago from the Eat Lancet Commission on Food, and they wanted to address the question of, can we feed a future population of 10 billion people a healthy diet within planetary boundaries? And what this expert panel concluded was that food is the single strongest lever to optimize human health and environmental sustainability on Earth, and that a diet rich in plant-based foods and with fewer animal source foods confers both improved health and environmental benefits. There was an article published in the New York Times a few years ago looking at the environmental impact of a variety of diets. And again, it's not a surprise that the vegan diet is the one that has the lowest environmental footprint. And we've seen sort of natural disasters, for those of you who may be in California, from the California wildfires to the burning of the Amazon, the bushfires in Australia, and even the COVID-19 pandemic have all been sort of connected to our dietary choices. For those of you who are interested in reading more about this, last year, in the height of COVID, there was an article published in the New York Times stating that the end of meat is here. And the byline was that if you care about the working poor, about racial justice, and about climate change, you have to stop eating animals. And I would argue that this includes dairy products. And the summary point from this article was that our hand has been reaching for the doorknob for the last few years, and COVID-19 has kicked open the door. On the other side is not something new, but something that calls from the past, a world in which farmers were not myths, tortured bodies were not food, and the planet was not the bill at the end of the meal. One meal in front of the other, it's time to cross the threshold. On the other side is home. And so changing how we eat is not going to be enough to solve the climate crisis, but we cannot address climate change without changing how we eat. And just one little quote from my co-author that I like to share. She says that being vegan isn't about personal purity or about moral superiority. It's about making a conscious choice to widen your circle of compassion by avoiding animal exploitation as far as is possible and practical. And briefly, I just want to discuss some of the safety issues as they relate to vegan diets, because I know for a lot of us, we're worried and concerned that eliminating dairy products, eliminating eggs in our diet would not be a safe dietary approach. And especially for those of you who are parents, you might be worried that your children won't be able to meet their nutritional needs if we eliminate animal products entirely from the diet. And then finally, don't we need milk for strong bones? So there was a position that was published in 2016 from the Academy of Nutrition and Dietetics. And this is the world's largest dietetic organization. And what they say is that it is the position of the Academy of Nutrition and Dietetics that appropriately planned vegetarian diets, including total vegetarian or vegan diets, are healthful, nutritionally adequate, and may provide health benefits in the prevention and treatment of certain diseases. Well-planned vegetarian diets are appropriate for individuals during all stages of the life cycle, including pregnancy, lactation, infancy, childhood, adolescence, and for athletes. I think most people get stuck on the words appropriately planned and well-planned, because what does that even mean? But a large percentage of this, the attendees today are vegetarian. So we face this issue of if you don't have meat in the diet, it's not healthy. And we know it's not true because we've grown up on these diets. There are some key nutrients that you may need to pay a little bit of attention to. And while we don't have time to discuss all of these nutrients, this resource is available on our website. The one thing I do want to advocate for is anyone here that is following an entirely vegan or plant-based diet needs to ensure an adequate source of B12. I think it's something in our community we don't talk about enough, but B12 is definitely one of the vitamins that you need to make sure that you're either getting in fortified foods or supplements. And I can certainly take questions during the Q&A about this more specifically. Studies have shown that children raised on vegetarian and vegan diets grow just as well as children who are raised on omnivorous diets. And then this brings us to the final section, which is, does milk really do the body good? Because I think that's probably the main area where there's some confusion. Do we need milk in the diet in order to be healthy? And for those of you who are interested, I highly recommend that you check out this article that was just published a few months ago in the New England Journal of Medicine, where they answered exactly this question, milk and health. And basically, I'm not going to sort of go over every single detail, but the overwhelming consensus from this paper, and these are Harvard researchers, so it's a pretty robust group of scientists that said that we don't need milk in the diet, that the evidence does not support heavy consumption of dairy in order to support health and specifically bone health, and that increased milk intake is unlikely to provide substantial benefits, and lots of harms are possible, including association between breast and prostate cancer, asthma, eczema, and allergies. It also exposes us to increased sex hormones from dairy cows. When you think about it, a lot of people think that if I drink, hormone-free or organic milk, that I'm going to avoid these things. But the reality is that in order for a cow to be lactating, she has to either be pregnant or have just delivered a baby. So there are always these sex hormones that are circulating in the cow, and we get those in the milk. Dairy products such as cheese and milk, again, as I mentioned before, are the main source of saturated fat. Calcium and vitamin D, we can obtain from other sources. We do not need cow's milk in order to get our calcium and vitamin D. And that, finally, limiting dairy production could have an enormous impact on our environment. And so a lot of people will wonder, well, if I'm not going to have dairy in my diet, how can I meet my nutrient needs? And the reality is there are an abundant source of calcium throughout the diet. Fortified plant-based milks, tofu, beans, tahini, sesame, greens, almonds. There's so many different foods that are a great source of calcium. Oops, I don't know what happened. Okay, sorry about that. And I wanted to just provide just one quick comparison so you can see what a reasonable source of calcium in the diet can be. So whole cow's milk, comparing it to a fortified soy milk, you can see that you get an equivalent amount of protein, even more calcium. It's both cow's milk and soy milk are fortified with vitamin D, so you can actually get, adequate vitamin D as well. It's significantly lower in saturated fat, and soy milk actually can provide some other nutrients. You'll see there's hardly any iron in whole cow's milk, but there is some iron in soy milk. And I think, this is what we imagine when we think about dairy cows. It's not harming them. They're in pasture and the mothers and the babies are together. But the reality is this is what factory farm dairy looks like. So it's quite a torturous process. Just a few summary facts about dairy. Cows make milk for the same reason that humans do, to feed their young. Their milk was not meant for us. Dairy cows are separated from their babies shortly after birth, and this is incredibly traumatic. The male calves born to dairy cows are slaughtered for meat. Females are repeatedly impregnated so that they'll continue to produce milk. And dairy cows undergo painful mutilations and sustain lots of infections, which is why we have to give them so many antibiotics. The average dairy cow only lives for 4 to 5 years, but a cow could live up to 20 years. But after 4 to 5 years, they no longer produce milk, and so they're slaughtered for meat. 65% of the global population is intolerant to lactose. So it doesn't make sense that we would recommend dairy as a necessary food when such a large part of the population, it makes them ill. And then finally, the government-funded dairy programs have really led to a lot of the dairy that we see in our school lunch programs as well. So just a few summary points about dairy. We are the only species to drink milk from another. Dairy recommendations, as I mentioned, discount the fact that so much of the global population is intolerant to dairy. And the suffering of these dairy cows is undeniable. And we can easily meet our nutritional needs without dairy. So I think that there is a strong, compelling reason to reconsider having dairy in the diet. We don't need it from a nutritional standpoint. We can get it from other places. And so really it comes down to taste preferences and cultural reasons. And I think we can easily overcome those with a little bit of experimenting, trying new things. And the last thing I want to say is just in the last 5 years, there's been an abundance of alternative products from plant-based milks to cheeses and things like that, that it's just become easier than ever to consider eliminating dairy in the diet. This is how you can get in touch with me, and I look forward to your questions.
Thanks so much, Reshma. That was a really high yield and data-driven summary of all of the components that we have often thought about in thinking of a whole grain plant-based diet. And so,
Nirali, if I could just interrupt for a minute,
yeah.
we haven't formally introduced Dr. Nirali Vora. So I just want to let you know that she's the one that's going to be facilitating questions, and she helped us with that poll that we did earlier. So Nirali Vora is a practicing stroke neurologist and clinical associate professor of neurology at Stanford University, who specializes in strokes, and she directs the Stanford Neurology Residency and Global Neurology programs. She's even worked in Sub-Saharan Africa in stroke center development. And she's been vegan for about 20 years, and she's the proud mom of 2 bright, healthy, active, young vegan boys. So I'll turn it over to Nirali to ask some questions and pull out some questions from the chat as well. Go ahead, Nirali.
Thanks, Gina. Yeah, so now you guys know I'm a stroke neurologist, and I appreciate, Reshma, that you shared the information about the impact of a plant-based diet on cardiovascular health. And you talked a lot about coronary heart disease, but I would also add that even though it's not fully studied in publications, that the same principles for a plant-based diet can really be beneficial for stroke reduction. And as many in the audience know, someone who's had a heart attack or stroke, since stroke is also the second leading cause of death globally and the #1 cause of disability worldwide. So it has broad reaching health impacts. And while I'm actually going to share my screen because we have another poll that maybe will prompt some discussion with Reshma and the group. So I'm going to just bring it up. I put a link to it in the chat box, and hopefully it's showing up here. What's the biggest challenge to becoming or staying vegan, given all these benefits we've just heard from Reshma? And people are putting some one-word answers in. So while that comes up, we're getting some questions here in the chat, and I think, as a pediatrician, you have keen insight on these issues of nutrition in children. And you mentioned some of the dairy alternatives. Could you comment a little bit on non-fortified sources, particularly ensuring that children get enough calcium through non-fortified sources? And there's been some discussion in the chat, but I'll let you take that first.
Yeah, so it would be difficult for a child to meet all of their calcium requirements without taking in some sort of a fortified plant-based milk. And the reason for that is the sources of calcium that tend to be the highest are like dark green leafy vegetables and things like that. And we all know kids can be picky sometimes, and they sometimes won't consume enough volume of those foods to meet their calcium requirements. You could take a calcium supplement as well. But I think for growing children, the most important thing is that they do get adequate nutrition. And so a fortified plant-based milk is your best option. When you think about most fortified plant-based milks will have about 300-400 milligrams of calcium. And it would be difficult to get, if you do a couple of servings of fortified plant-based milk and then eat the dark green leafy vegetables and the sesame seeds and the tahini and the almonds and all those things, it's not that difficult. So I think not using a fortified plant-based milk, it may be difficult for some children to meet their calcium requirements.
Thanks, Reshma. And just as you mentioned in the chat, others are commenting about the calcium amount in sesame seeds, dark green leafy vegetables, but certainly you can get it a lot quicker and with less inertia, perhaps, which is one of the challenges I'm seeing here on the screen, using a fortified soy milk, essentially.
Yeah.
And, speaking of inertia, because a lot of us, and that's my personal story too, thought about becoming vegan for a long time. It sort of takes that extra effort because, as you mentioned, we have to be really conscientious about what we're putting in our bodies. And we can't just say we're vegan and then eat like artificial cheese and saturated fats and processed items. We really have to be holistic about it. And so one of the questions, particularly as meal planners, which often falls predominantly to women in the household and in traditional families, what's an easy way to think about getting the whole family, when you're the one responsible for cooking, to think about making that transition? And how do we, and I'm just going to read the question here. What are some practical issues for the ones making the food, in particular, with respect to transforming their family's diets or trying to. And so maybe you can comment on that.
Yeah, and I think, it's every family, it's going to be a little bit different. And I also think it depends on the ages of your children. So if you've got very young children, that's kind of just how you start. And actually, in this community, I think we probably have more skills than you realize, because in terms of not eating meat, that is a huge divergence from what most of the people around us do it. So we've become creative in terms of, how do you handle that other families may eat chicken or beef and you don't? It's about talking to your family, expressing your values. And then especially for kids, I think finding the easiest solutions. Like for instance, in my family, we used to have cow's milk in the house. And when I decided that we weren't going to have cow's milk, I tried a different variety of milks, found the ones that my kids liked, and I just stopped buying it. So I think sometimes you just have to, expose your kids to a variety of different types of milk, see what they like best. And while I agree with you, you absolutely want to focus on whole foods, you want them to be wholesome, but when you can find some plant-based alternatives that can make it a little bit more enjoyable for your kids, I think it can be easier. So trying a vegan ice cream or something like that, not all the time, but finding things that make them excited and make them feel like you really do want them to enjoy the food. I think that's really important.
That brings up a good point and another thread of questions in the chat. It's something I think we often debate amongst the vegan and vegetarian households, which are these sort of plant-based imitation meats or artificial proteins, and the balance between easy access and having food that maybe looks like a peer's food versus non-processed holistic foods, which is what you were sort of getting at, that there's this balance, and that even within veganism there's moderation. And so maybe if you could comment a little bit on your perspective, and we can actually have a whole debate about this probably. But
well, I think the important thing to consider is in comparison to what, right? So if you're going to have like a vegan cheese or an Impossible burger or whatever the thing may be, it's going to be much better than an actual animal burger, a beef burger, but it's not maybe going to be as wholesome as a black bean burger that you make at home. So I think you're always sort of reflecting in comparison to what. So I think that these products, you're going to have to find a balance. I can speak as a pediatrician and as a mother, the more restrictive that you become about these foods, the more that they're going to want them. So I think if it gives you a little bit of flexibility that you can go out with your peers, you can go out to dinner, you can attend a function and have a vegetarian vegan option, it really goes a long way. And the way that we handle it in our house is we don't necessarily have those kinds of foods in the house, but if you're going out and you have them from time to time, I think it's fine. And then the other thing I would add is it also depends on your health status. So if you're someone who has diabetes, who has heart disease, you may really want to avoid those kinds of foods. But if you're otherwise healthy, having them from time to time, especially if it adds convenience and enjoyment, is perfectly fine.
And I think to add to what you said, we are all self-educating, and so we do have to read the labels, and we have to make conscientious choices about, does this actually have saturated fat or not, and what it might be. And so empowering each other with the knowledge and creating community about what is relatively healthy or what is an alternative when you're struggling to maybe make a transition with your family, yes. I think is totally valid. And I also think that as you become more comfortable, then you can start to adjust, right? We're not static in any way. We're dynamic humans that can make adjustments and improve ourselves. So
yeah, and for some families, it might mean that you're entirely vegan at home, and maybe you give yourself a little bit of flexibility when you're out of the home if it seems a little overwhelming. And I promise you, the more that you stick to it and have patience and have persistence, it becomes easier and easier. And then you'll reach a point where you think, I wonder why I ever thought it was so hard. It really doesn't have to be. Just start and keep going.
And I'll take a quick moment to pause and reflect back at the word cloud we have popped up here. And just to know that you're not alone. For many of you who have these challenges, you probably see something on here that reflects your own thoughts. And some of you have no issues staying vegan or achieving your goal, but certainly, this issue about milk that we've spent a lot of time of this section discussing is a critical challenge for many, and inertia. And then you can see some of the other comments for just knowing in your community. But I'm going to stop the screen share and ask a few more questions. There's a specific question about what amount in percent USRDA of B12 supplement is appropriate to take and how frequently, since that was such a critical point you mentioned.
Yes. And what I can do is when I'm done on my part of it, I will take a screenshot of the part in our book. And the reason it's not a straightforward answer, because it depends on a variety of factors. It depends on your age, and it depends on how often you're taking the B12. So the dose is going to vary, depend on if you take a daily supplement, there's also sprays that you can take twice a week or once a week. So for most of the audience, I would say that there's a vegan spray that comes as 500 micrograms. And if you do that a couple times a week, you're fine. But if you're taking a multivitamin that has B12, it's going to be different. So there's not a clear-cut answer because it depends on how often you want to take it and if you're taking a multivitamin. What I'll try and do is, I think, Norella, can I take a screenshot and share it in the chat?
Yeah, go ahead. I think you can.
I'll do that when I'm off screen so that I'm not taking time.
File. Yeah. And then there was a discussion about, different types of milks, almond versus soy, and JAINA did answer some of that. But essentially, we both agree, almond milk is lower in protein than soy milk. And so that's why I think soy milk tends to come up on top for protein. Any other thoughts, Reshma?
Yeah. So one of the things I would like to emphasize is that the plant-based milks that you like try a variety of them. The one time where I actually recommend a soy milk versus almond milk is during when you're weaning off of breast milk or formula. And the reason for that is you want to provide something that's sort of equivalent in calories and nutrients as cow's milk, because growing children need the extra fat, they need the calcium, and they need the calories. So soy milk ounce for ounce is going to be the most comparable to a cow's milk. If you're allergic or have an intolerance to soy, they also have a lot of pea protein milks. So a glass of soy milk is going to have about 8-9 grams of protein, which is equivalent to cow's milk. Almond milk it's very low in calories. It's essentially just kind of water. I think of almond milk as a substitute when you're not really, concerned about the nutritional profile, but more just about the taste and the flavor. So if you like almond milk in your cereal, it's perfectly fine. For younger children, I like that fortified soy milk has more protein, more calcium, and some of the other nutrients that they might need. So between the ages, I would say 1 and 3, try to stay more towards like a soy or pea protein milk. And after that, as long as the children are growing well, really use the milk of your preference.
Thank you. There was a comment about any recommended resources, websites, or books for incorporating foods or recipes to be completely vegan. Any tips?
Okay, we could have like an hour conversation just about that. So the first place I would recommend is on our website for the book and on my personal website, which is just Reshma Shah MD. I have tons of resources. So one of the things I recommend is just go to, if you don't want to buy all these cookbooks, there's so many different blogs, and I have them linked on my website that can give you inspiration for making plant-based meals. Yeah, the books and the resources, there's so many out there. Of course, our book, if you're interested in pediatric nutrition, it's entirely focused on pediatric nutrition. Yeah, there's just, there is an endless amount of resources.
And I'll add, if you're in the Bay Area, we have like a WhatsApp vegan group, and there's so many resources that you can help, but I think your community can continue to help. I want to bring up an important question that often comes up about the safety of soy and if there's an excess amount of soy products that one can consume.
Yeah, so I can say unequivocally that soy foods are one of the most health promoting foods. When you look at countries that consume a lot of soy, like a lot of the Asian countries, they have some of the lowest rates of breast and prostate cancer. Even in people with a known diagnosis of breast cancer, soy has been found to be protective. So a couple of servings of soy a day, 2 to 3 servings in an adult. And I like to stay as close to the whole soy as much as possible. So things like edamame, tempeh, tofu, soy milk, those tend to be less heavily processed in terms of the soy content. Some of the veggie meats will have soy isolate protein, so it'll have the ratios of some of those added components will be a little bit higher. But 2 to 3 servings of soy a day is absolutely healthy. The only reason I would say not to consume soy is if you have an allergy. Some people with a thyroid condition, you may need to consult with your endocrinologist in terms of the amount of soy you consume, but it's absolutely health. It's safe, and it's actually been found to be protective, especially against breast and prostate cancer.
Yeah, and because there was a specific concern about estrogen because, you know, the chemical structure of soy is like a phytoestrogen. People get concerned, but
Yes.
Reshma, you can.
Yeah, but they're
comment a
two
little bit more.
totally different thing. And the way that the phytoestrogens in soy interact with the receptors, they actually are protective in terms of bone health, in terms of reducing our risk for breast cancer. So there's two case reports that have looked at feminizing effects of soy in men. And in both of those two case studies, it's not even a full study. These men were consuming 20, 30 servings of soy a day. So don't have 30 servings of soy a day, but 2 to 3 is perfectly fine and appropriate.
And the last question before we transition over is just that, you know, people focus on certain things, calcium or protein, and there's a lot of other things we can talk about, oil, sugar. Maybe you can make a brief comment about those other areas, and then I'll just make a general comment that, yes, you know, in nutrition, it's not just about one component of the diet, and we have to really look holistically, which is why cooking at home and making this whole grain plant-based approach is really helpful. But Reshma, if you could talk specifically about oil or sugar. And sugar.
So I think it goes back to sort of what I mentioned before. It depends on your health state. So if you're someone that has significant heart disease, has type 2 diabetes, you may want to limit your consumption. The reason mostly to limit our consumption of oil is because it's a really concentrated source of calories. So if you're looking to sort of reduce your caloric intake, oil has a lot of calories for even a tablespoon. So, but if you're an otherwise healthy person, I think, you know, using a little bit of oil in cooking, if it's going to increase the flavor, using a little bit of salt, I think it's perfectly fine. If you have type 2 diabetes, if you have heart disease, if you have high cholesterol, you may want to look at limiting some, you know, how much oil and salt and those added things you do. I think just in closing, I want to say that it doesn't have to be overly complicated. I think the key is consuming a variety of foods. So, you know, the legumes and the vegetables, the more variety you include, the more nutrients you're going to get. The more, exactly what you said, the more that you cook at home, the more you're going to increase the healthfulness of the meals that you serve your family. And then the last thing I want to do is it absolutely should be, you know, food is meant to connect us and it's meant to be joyful and it's meant to be enjoyed together. So don't forget to sort of celebrate all the things. And I think, you know, for those of us who grew up on a vegetarian diet and were sort of outside the culture of what most people did, we know that this way of, if anyone told you that being vegetarian is bland, is tasteless, it's hard, it's this, we would disagree because we know differently. And I think the same can be said about a vegan diet. It can be really abundant and flavorful and delicious. You know, it's just something to consider.